So my interest in healthcare and innovation came at quite a young age. My older brother, Stephen, or Stevie as he was known to many, was born with severe cerebral palsy. He was actually born in Bishop Auckland General Hospital, but was transferred to the special care unit at Newcastle General Hospital, which is about approximately 45 miles away from home. And he spent between 5 and 6 months of the first months of his life in Newcastle General Hospital. So as a result of that, my mum had to give up work to sort of be with him. And then thereafter, he was transferred to Bishop Auckland General Hospital. He pretty much defied medical sort of science because my parents were told he wouldn't live till he was 1 or 2, but he actually survived until he was 20. In the late 1980s or early 1990s, my parents were asked to trial 2 pieces of equipment. One was a portable nebulizer inhaler and the other was a portable suction machine. They were very simple innovations and they were quite small, but it meant that the 2 pieces of equipment could be put underneath his wheelchair. For the first time ever, it enabled us to be a family of 4. So the innovations didn't just really help him, they changed family life forever. Those fundamental 2 pieces of equipment were sort of critical to our life, so my mum kept them with his treasured possessions when he passed away. So this was the portable nebulizer inhaler. As you'll see, it's just a simple foot pump that's attached to the nebulizer mask, and it allows the Ventolin or salbutamol medicine to actually be aspirated through the mask. And then this here was the handheld suction machine. And I'm not quite sure how they did this with one hand, but you pump here, it creates a vacuum, and then this tube itself would actually go into my brother's mouth to sort of clear his airways. My personal experience has helped shape my experience in life. So I feel very, very passionate about my current role at the AHSN and the AHSN in its entirety, because every day we're being exposed to new ideas, to unmet needs, where we can actually make a difference. So we've had some fantastic ideas come through the Bright Ideas Awards over the years, from very, very high-tech and complicated ideas where we may have even struggled with the title, through to very, very simple ideas that have ultimately all gone on to help and benefit patients.
The Kids Med team was so excited when we won this award, and it was one of those moments where it made us feel like a real team, and that actually gave it a little bit more push and made people want to take part in it more. So that's been really important as to how you disseminate and spread the word of your brilliant things that you've developed.
The Health Award can be a great way to demonstrate independent recognition for your innovation. It can also be a motivator and an advantage when you apply for further project funding.
For one, obviously, the biggest thing is you get recognition, which puts a lot more focus onto your project. It's nice to be able to sit down in front of potential investors and stuff like that if you need to raise funds to say, look, it's an award-winning product. So as far as giving the project credibility, that was key to getting to where it is now, actually, because you can get more people involved.
To some extent it legitimises what we're doing here. It legitimises the innovative kind of practices and ideas that other organisations are having. Unless you've got a platform for that kind of profile raising, then you can often go unnoticed. So it is really, really important that we've got an organisation like your organisation that's noticed what we're doing and rewarded us for it. Essentially, it's been a great help for us.
There are so many altruistic people working in healthcare across the region, and I'm really privileged that we get to work with them on a day-by-day basis, and the impact that they can make directly to patient care, and I feel a real sense of pride in working with those people.